Hello, my name is Dr. Saffer and I am a diabetes consultant in the Southern Trust. I'm making this video today to talk about diabetes and Ramadan. Ramadan is the holiest month for Muslims all over the world. During Ramadan, Muslims fast between 10 to 20 hours, and this can be a bit challenging for people with diabetes as it puts them at a higher risks of low sugars, high sugars, and dehydrations. And this can sometimes lead to certain complications like formation of clots and ketoacidosis, which is life-threatening, and we always try to avoid. This is why it is important that for people with diabetes to have a discussion with their doctor, preferably 4 to 8 weeks before the beginning of Ramadan, to make the necessary changes and to know if it is safe for them to fast or not. Sometimes we advise against fasting for certain groups, such as people who have problems feeling they have low sugars or who have frequent low sugars, people who have some complications of diabetes, those who are treated with insulin, or certain groups like the very young, the pregnant, and the elderly. And it is only because fasting will be associated with a detrimental effect on their health that we advise against fasting, and there's agreement between the medical and the religious authorities on this matter. For people who have well-controlled diabetes and who are treated with tablets or with some medications, or even sometimes those who are treated with insulin once a day, these groups can fast, but they have to follow certain rules. The first and most important rule is that you need to check your blood sugars frequently, unlike the other months, like 5 or 6 times per day, ideally before suhoor, in the morning, in the mid-afternoon, and before iftar and after iftar. At any point, if the sugars show that they are less than 4 or more than 16, or if you feel unwell or if you have symptoms of low sugars, you need to stop fasting immediately and break your fast and treat low or high sugars accordingly. The other advice that I would give is generally people who are treated with tablets, better to take the higher doses with iftar, and obviously it's better to talk to your doctor because sometimes he can advise changing one type of tablet into other to avoid low blood sugars. What to do regarding your food is also very important. Generally during the month of Ramadan, we love to have our sweets. But for people with diabetes, they need to make the necessary adjustments. For example, it is advisable to break the fasting with iftar with 1, 2, or 3 dates and have plenty of water. Have food that is low in sugars and low in sweeteners, and try to have a balanced diet that is rich in protein and fiber that can give them good satiety. During the hours between iftar and suhoor, it's important to keep yourself well hydrated using non-sweetened beverages. The other thing is, it is of utmost importance that you never miss your suhoor because if you miss it, you'll be at a very high risk of low blood sugars, and it is also advisable to make it as late as possible and to have some high protein meal during suhoor. During the day, you can do some mild exercise, but it's advisable to avoid any heavy exercise as well, and generally prayers are considered good enough exercise. These are just general rules, and it is different for each and every individual with diabetes, and that's why I advise always to talk to your doctor. We have our community diabetes team, and you can find their number on the Southern Trust website, and we are always happy to provide help and advice and support you through your Ramadan. Our only concern is that you fast safely. Ramadan Kareem, and I hope it brings you all to joy and happiness and reflections that it always brings myself. Thank you very much. Keep in touch, stay safe.